What have you had done? And I know that now you're a true advocate of non-invasive procedure, but what have you had done before?
I had my eyes done, and it wasn't a happy experience because I had to go back and have things redone. When all the aesthetic, non-invasive surgery started, I thought that's the thing to look at. And there's so many amazing treatments and pills and all kinds of things. I'm sure the good doctor here can tell us a whole bunch more about that. I always say to ladies, you know what, you have the choice. And it's not for me to judge or to tell you what to have, but have a look at all the options available.
I need to ask the good doctor at this point, what is the yardstick we have in South Africa that tells us we are seeing a good doctor and not a cowboy?
Unfortunately, this type of medicine is currently unregulated in South Africa. However, what we have done now as a group of cosmetic physicians, that is a group of physicians who do not cut the body in any way, we have now formed a society called the South African Association of Cosmetic Doctors, and it may be valuable for the public, if they do want to consider such procedures, to actually visit this website to find an accredited doctor who has had a suitable training.
And not have this done in a beauty salon or a hair salon.
Absolutely not.
Absolutely. I mean, you're in trouble when you walk into your hairdresser and they're doing Botox.
The problem is botulinum toxin is a scheduled medication. It's a Schedule 4 drug. And if it's injected into the wrong muscle, you can have major problems. So, as a doctor, Schedule 4 drugs are only allowed to be used by doctors.
Okay, who's the best candidate for non-invasive surgery? At what age can one start? You know where I'm going, right?
I know where you're going. I would say anyone over the age of, from 25 onwards, we're seeing people who are actually opting for preventative treatments now. So they look at their mums and they say, gosh, we don't want that frown, we don't want crow's feet, so let us go and have these procedures done before we actually develop those lines. But, if we start talking about liquid facelifts, anyone over the age of, say, 45, that's the age group I'd be looking at doing these procedures.
What